Welcome to Redefining Medicine, an intimate and personalized program that illustrates a different side of the practice of medicine. Our in-depth conversations will focus on the physicians and practitioners who are redefining medicine through their integrative, functional, and holistic approach to health and well-being.
We are pleased to welcome Dr. Farah Sultan, an integrative functional medicine practitioner, board certified with the American Board of Anti-Aging and Regenerative Medicine. Welcome.
Thank you, Phil. So glad to be here.
You own a practice in Birmingham, Alabama called Vitalogy Wellness Center and Medspa. Can you tell us a little bit about that?
So I started my journey into integrative and functional and regenerative medicine. In 2010, I attended my first A4M conference in Atlanta, and it was such an eye-opener and so exciting for me that this is the way I wanted to practice medicine for the rest of my life. I had been trained in family medicine and board certified in internal medicine in England, but then I made a complete switch and opened Vitalogy Wellness Center in 2014, and very soon after got board certified with A4M.
Tell us a little bit about Vitalogy. What kind of services do you offer there?
My niche is bioidentical hormone therapy for both men and women of all ages. We also do core functional medicine programs and help people with lifestyle testing, gut health, and autoimmunity, as well as brain health, because those are things near and dear to my heart because of some issues that I was going through with my health as well.
Do you want to share that story at all?
So after I had my first baby, it was after an emergency C-section. And soon after that, I noticed that there was something really wrong with my whole system. It was just not functioning right. And so I would experience symptoms of intense fatigue, weight gain, hair loss, headaches, tummy upset, and absolutely zero sex drive, and just couldn't figure out what was going on. And so at the time I was training as chief resident in Houston, and I went to my OBGYN and asked her what was going on. And she essentially said it was part of the normal thing of becoming a new mom. And that was just not an acceptable answer to me. And despite all these years of training as an MD in medicine, I still couldn't figure out. And it was kind of frustrating because here I was trying to see patients and help them, but the only tools that I was equipped with were some of these pharmaceuticals and medications and some basic lab testing. And so it was eventually that I found functional medicine in my journey, and it truly changed my life. And I discovered that I had IBS issues, that I had Hashimoto's autoimmune thyroiditis, where my own immune system was attacking my thyroid, which is now a common story I see in young women after they've had a C-section or hysterectomy or any other surgery. And so that's what was such a turnaround point in my life that I decided that it would be almost unethical for me to practice the way I had been doing. And it helped me to see the same results in my patients. And that's why I'm so passionate about what I do. And I absolutely love what I do because it truly changes people's lives. It makes a difference in people's lives. And you're really not using toxic medications, but lifestyle and lab work to really get to the root cause. And that's what I love about this kind of medicine.
And having experienced those issues yourself really gives you a better understanding of what they're going through, and they can connect with you better too, right?
That's so true, because I can identify exactly how they feel and truly empathize with my patients. And that makes them more receptive to what I'm asking them to do in terms of lifestyle changes. So I wouldn't ask them to do anything that I'm not willing to do myself. So I really believe in walking the walk and talking the talk. And that has also really helped me to get awesome results.
Give us an idea when you're seeing a patient for the first time, that initial consultation. What are you looking to find out besides establishing a rapport and a relationship? But what are you looking to learn in that initial consult?
Definitely, I go through their timeline and deep into their history to see really what happened in the past that might have triggered what is going on right now. So other than delving deep into their history, I also really take a deeper dive with very comprehensive lab work. So I'm looking at inflammation, hormones, micronutrients, food sensitivities, adrenal symptoms and adrenal fatigue, which is so common among my patients. And then more sort of elite testing for genetics and looking at biotoxin illness like mold and Lyme for the more complex cases. And that's how I'm able to really help them see that what they're going through has a cause, has a reason, and that there's hope and something can be done about it to lead them to this path of hope and healing and health. And it may be slightly different, but not difficult.
Do you find that a lot of issues that people are dealing with, autoimmune disease and such, has been brought on environmentally?
Very certainly. So, autoimmunity can have a genetic component, but more importantly, in many cases, it has to do with stressors, toxins, the foods we're eating, the GMO foods, as well as when you have antibiotics, when you have surgeries, they disrupt the normal environment, especially with the gut microbiome, which, as you know, plays such an important role in our overall health, whether it's brain health, heart health, gut health, joint health. And so that's been amazing that in conventional medicine, we treat autoimmunity by trying to suppress the immune system, whereas in integrative and functional medicine, we're really finding out what those triggers are and trying to remove them. And that's what helps people go into remission.
You mentioned brain health. A lot of times conventional medicine separates, mind from body. And as we know, a traumatic injury or something can trigger a mental health condition, whether it's anxiety or ADHD or obsessive compulsive disorder. Can you talk a little bit about how you try to understand and balance the physical as well as mental and even spiritual?
So, as you know, Phil, good health is really a culmination of mind, body, and spirit. And a lot of times we do tend to separate like chin below and chin above. And so when we look at the person as a whole, so suppose they're suffering from symptoms of depression, anxiety, and ADD, or cognitive decline, brain fog, then the good news is when you look at the gut health, because the gut is the second brain, when you look at their hormone imbalances, no matter what their age, or their micronutrient deficiencies, a simple thing like they're not getting enough good omega-3s and vitamin D and B vitamins in their diet, even though they're supposed to be eating healthy, but they're not absorbing those nutrients. There's so many things we can do to help brain health and cognitive health just by balancing this and mindfulness. So stress, as you know, can be a big spanner in the works. And unless we balance that stress, just simple things like eating mindfully and taking a deep breath and meditating can have such a huge impact on brain and mind, body, spirit health. And it's truly amazing to see those results. Another modality that I also use is neurofeedback, because that has zero side effects, but it has, it's almost like setting the brain off its state of, like your iPhone freezes up on you. So the brain can get into these set patterns, and you're just kind of giving it a mild signal to get unstuck in your brain.
And where does exercise and activity fit into your consultation with your patients?
I am a big proponent of movement, especially right now with all the gyms being closed. There are so many things that our body is capable of that we can help it with just simple movements without the need of much equipment. And especially with this pandemic, people are stuck to their devices, our kids are stuck at home. And so it's so key for your good immune system, good musculoskeletal health, good heart health, brain health, is to just do something. Like you could dance, you could use your own body weight, you could do gardening, and just cleaning your home. There's so many things we can incorporate. And I love yoga and HIIT training, and I'm able to do that at home. And there's so many YouTube videos. So definitely I use these 5 pillars of health approach to my patients that includes detoxifying your gut, nutrition, hormone balance, fitness and movement, and mind-body balance. And so that includes stress management, and then just mentor them through this whole process. And that kind of helps you touch all the bases of your health and get amazing results.
Now, many of the things that you've described and offer through your practice, a lot of them seem like they would not be covered by insurance. Is yours a concierge practice?
We bill some blood labs to insurance, which we are able to get covered, but the rest is cash-based and membership practice.
The other part of practicing this way is that you no longer have an insurance industry that is telling you how to treat your patients, right? Is that liberating?
So liberating, because I was getting so frustrated. My patients were doing better, but instead of being rewarded for taking better care of my patients because I was ordering these wonderful labs, I was being penalized that I'm overutilizing these services, and things that the patients really deserved and needed were things that were not being covered. What was being covered was just another drug or another, preventive vaccine or something like that, which really did not do much to enhance their wellness. And so, and the paperwork, I mean, it was crazy. So I'm so glad that I'm no longer dealing with that.
So your practice also offers a Medspa. Can you tell us about that?
So again, Phil, with my A4M training, that inspired me to open a Medspa, because I feel like when you feel good on the inside, you also want to look good on the outside. And I love all the groundbreaking therapies that are offered through our training at A4M. And so I incorporated those at my Medspa as well. So we do platelet-rich plasma for hair rejuvenation, for facial rejuvenation. We do sexual rejuvenation with the O-shot, P-shot that I trained with Dr. Runnels for, and joint health. And then we have laser and body contouring treatments. So all of that, along with IV therapies that we do, really takes care of the inside as well as the outside. Because we're living longer, there's no reason why we should not feel good, but also look good. So that's something that I love doing as well. And, that's an area of interest of mine. And we have estheticians and IV nurses on board. So that really helps that as well.
We thank you very much for joining us today on Redefining Medicine.
Thank you so much for having me.